ANR treats every patient that walks through our doors as a human. Opiate dependency does not define who you are. It can happen to anyone. Dr. Waismann developed the process of Accelerated Neuro-Regulation 30 years ago.
A person looking to break the grip of addiction to a powerful opiate like heroin needed to endure an agonizing physical withdrawal. Now, an Israeli doctor promises he can cure an opiate addict pain-free and have them off the drug within 2 days.
I don't treat drug addiction. I treat opiate dependency, which is a central nervous system disorder.
Most of opioid dependency treatment is about making sure that you alleviate the symptoms, cravings, withdrawal, etc. But you're not getting to the root of the problem, and ANR is a totally different perspective than what everybody is doing. We analyze this and treat this from the neurobiological perspective.
Everyone has opiate receptors. Everyone has endorphins. Every time someone takes an opiate and abuses an opiate, they create an abundance of opiate receptors and a diminished amount of endorphins.
These extra receptors that are now asking to be fed. They're not only asking, they're demanding. That's the craving, that's the dependency. So it's at the neurobiological level that this change occurs.
We repair a damaged endorphin system. You really have to think of this as a major medical procedure. You're just not getting a scar. Every patient gets an individualized treatment plan from the moment of consult. We do a full medical review of their medical history, surgical history, what opiate they're using to any other substances they're using. And then we start developing a treatment plan.
First process is removing those opioids from those receptors and binding them with an agent that blocks those receptors from being active. In that blocking, those receptors become quiescent and eventually they will disappear to the point where cravings are irrelevant.
We treat the damaged endorphin system and it's one and done. We don't, have you come for an NA meeting, AA meeting. That's not what we do. We want you to go and live your life. We're totally opiate free and enjoy that because you're no longer chained to anything.
I became absent. My personality was different. I lost friends. It was just a dark place to be.
And you're stealing, you're robbing. It's a nightmare.
I was addicted to fentanyl. Before that, it was heroin. Before that, it was Oxycontin, which I started on. Got myself in a shitty situation and tried to dig my way out of it, but I couldn't. So, yeah.
I was absolutely terrified about the dependency on all these drugs. To me, ANR was the only option.
I woke up and I knew it was done. I just knew. I feel like ANR just unlocked a part of my brain. I'm better than I was before.
Everyone looks at me and says, "You look happy now. And we got you back, and your personality's back."
I was on oxygen and taking massive amounts of drugs per day, so I never thought I would do anything again. After doing the ANR, everything is back on the table. There is not a day that goes by that I don't share what happened to me and ANR with someone.
When I woke up from the procedure, I had no cravings for any opioids whatsoever. Had taken them almost daily, maybe twice daily for 10 years straight. Kind of crazy. But now, I feel normal again. I'm free of that. I'm not locked up anymore.
There's hope. If you're watching, there's hope.
Opiate dependency is a disease that can be cured. Our vision at ANR is that we're in every hospital in America and any patient can walk in at any time to an ER and say that they're opiate dependent and it's treated.
It's time that opiate dependent patients would not be defined, but they will be allowed to enjoy the advantages of modern medicine. The ANR procedure will reverse the roots of the problem, and it will allow human beings to enjoy the benefit of being a human being.
ANR has demonstrated time and time again that it treats and cures opioid dependency. without a shadow of a doubt. We don't judge. We don't care who you are, because we know that you're a human being. You deserve treatment. You deserve to return to a normal life. Every human being deserves that right.